Okay, I think we'll go ahead and get started because it's 1 o'clock or after 1. So, good afternoon. I'm Barbara Rosenberg, and I want to welcome everybody. I'm a senior advisor with ElderWorks. We are a not-for-profit 501c3, and our mission is to help seniors and their families relocate to senior living, if it's independent living, assisted living, memory care, or if they want to stay home, to stay home safe with the best home care. And we refer licensed, insured, and bonded agencies. Also, the communities that we refer are all private pay communities. And in addition, as a not-for-profit, we help people who are on Medicaid, people who have no means. We try to come up with really good resources for them. If it's a skilled care nursing home that takes Medicaid, try to make referrals for discharge planners. We're having issues with patients that don't have any means. We really do everything that we can to try to help all seniors and their families, but we're funded by those placements, those private pay placements, as well as donations and grants. We also educate nurses, social workers, and nursing home administrators with their continuing education. We have a massive amount of CEs available for that purpose. We also do a community event such as this. So without further ado, I want to welcome everybody that is on here today. And Michael from HealthMarkets, thank you so much for being here. And the whole Medicare piece is something that is so confusing for people sometimes year to year. And for those of us, I'll be turning 65 next year. I've been very educated about it, obviously, with what I do, but always picking up and learning something else. And so thank you for being here, Michael, for us, and you can talk about yourself a little bit and go ahead.
Great.
And
I do have one question for you, Barbara.
Yeah.
I guess on a personal note.
Sure.
I have someone who's really, they're going to end up moving him back to, he lives in Chicago now, but he's going to be moving. He's on Medicare. It's going to be moving. They haven't decided it's on the border, either New Jersey or Pennsylvania, based on who gives the most for Medicaid and stuff like that. Do you guys also help people that are moving to other states that they have questions?
No, we're only licensed in Illinois. However, you are more than welcome to have that family call me because they may have questions that I could answer.
All right.
You're more than welcome to have that family call me. But we are in Illinois, but lots of times the general questions I can really help with.
Right. I could sort of do some of the Medicaid stuff, but I didn't know. So
yeah,
great.
You're more than welcome. I wanted to also mention for today, any personal questions or requests about certain types of Medicare plans, Advantage plans, et cetera, you will need to contact Michael on your own because specific plans or quote unquote sales is not going to happen today. This is more general information. Michael's information is in the chat, 847-477-3343 at HealthMarkets. And then his email, I put it in incorrectly the first time, the second time. So you could see that in your chat, michael.mann@healthmarkets.com. So I just wanted to mention that. So go ahead, Michael, and then as you have questions, folks, you can interject.
And it's regulated. This industry, I mean, I've got tens of hours every year doing AHIP certifications, carrier certifications. I don't want to lose my license.
Correct.
That's why this is educational. So
Correct.
if you do have questions about Medicare Advantage in general, policies, plans, but like you just can't ask about one carrier, is this a good one type deal.
Correct.
But otherwise, any other questions are fine. And then like
as we go through the slides, if you have questions, everyone, you can, that's okay to chime in. You don't have to wait till the end or anything like that. So
exactly. This is, I mean, I know Hermina and Pervez and then Ray and Pam, feel free to ask any questions at any time. This is very open. There's no time frame. So whenever you guys are done, you're done. Although I think it's supposed to be an hour, but like I said, if you've got any questions.
Take your time. Take your time. I'm going to go off camera. I'm going to go let you do your thing.
Okay, and I do appreciate, I mean, I know technology for a lot of people is a little bit tough, so I appreciate you guys are all getting on here because it takes half an hour just to explain stuff to people to get on here. So here we go. So like I said before, my name is Michael Mann, and she did tell you my phone number, which is 847-477-3343. That's the best way. I can then talk to you. I'm not allowed to call up anybody. That's why I'm not even writing down anybody's names. I'm not allowed to by law, but you're more than welcome to call me up with any questions. It's 847-477-3343. My company, HealthMarkets, we're the biggest in the country. So as far as brokers go, so I have the availability to use pretty much every carrier out there. It's Aetna, Cigna, Humana, Devoted, Blue Cross Blue Shield, Mutual Omaha. Things that I've done for my community, Rotary, Barrington Career Center. I teach LinkedIn classes, Crohn's and Colitis Foundation. I've been a village trustee at the Village of Deer Park. So needless to say, I used to do a lot of importing. I've done a lot of different industries, but the reason why I picked healthcare is my wife pretty much said, I do so much volunteering. Why don't you do something to help people and get paid for it? Because I've been doing so much. So now I really enjoy it with Medicare because it's so confusing to people. I really enjoy it because when I see people getting taken advantage of with those phone calls, you see Jimmy Walker and everybody thinks they're telling the truth, or Joe Namath. I'm always very honest. I'll tell you to stay with that plan or to switch. I mean, it makes no difference to me. One person's not going to dictate my whole life. So I'll be honest. And I also, if you have family and friends, I have 15 states I cover. So I can do all the different states. So feel free. All right, so I'm just going to go through some key terms about Medicare and also displays the healthcare. And if anything seems like it's not sure about, feel free to ask me. First one's beneficiary, individual covered under Medicare, that'd be you. Premiums, that's how much you would owe every month. So keep in mind, we're going to go into detail a little bit later about Parts B, but premium would be if you were getting like a supplemental plan. We'll talk about that later. There might be a premium every month for $120, $130, or some Medicare Advantage plans might have some premiums. Some have $0 premiums.
You're still on the first slide. You're still on the welcome slide, on the Medicare 101 slide.
Oh, I am.
Yeah, you can advance your slide.
Let's try it again. And we'll do. How about that?
There's your next slide.
All right, once again, I'm Michael Mann. You already know we talked about the different carriers and stuff I've done. And then do you see key terms? Yes, good. All right, so yes. Beneficiary, we talked about premiums. That's what you're gonna owe every month. Deductibles for Medicare Advantage plan, you have a $0 deductible, but some other opportunities, if it's just plain old Medicare, you might have $260 deductible. So that's the preset amount you have to pay first before they start taking account your insurance and giving you discounts. You still have to pay the deductible first. Co-payments, preset fixed amount you pay each service provided. So I'm going to go see my doctor, and primary doctors, $10 copay. Some plans are $0, some might be $50, but that's how much you have to pay to go see that doctor. And then co-insurance is usually like a percentage. That's like 30%, 20%. They're going to tell you a percentage you have to pay for getting an x-ray, getting MRIs, and stuff like that. Okay. So Joan's 64, planning to join Medicare at 65 years old. Doesn't know much about Medicare, federal health insurance programs. So Medicare started in 1965. And if you're 65 or older, you can get it. Some people with disabilities, have certain kind of diabetes, heart disease, they're also qualified for Medicare. End-stage renal disease. So that's how the age group is for Medicare. That's a little red, white, blue card. And you can see there's hospital Part A and Part B, and that's your Medicare number. I always tell people Medicare number, Social Security number is the most important number. Don't ever give that to anybody. Medicare number is pretty good too. You really don't want to, but once you have a licensed agent or fiduciary, you would need to give us our number, especially right before you ever sign an application, because they got to make sure you're put in the right area. So that's the only time. Otherwise, I won't just give your Medicare number out to anybody. There's 4 parts. So as we mentioned before, you got that Part A. A stands for like hospitals, skilled nursing, home health care, and hospice. Everybody can get Medicare Part A. It comes to you as long as you worked 40 pay periods. So for pretty much if you work 10 years, then you qualify for Medicare. If you didn't work 40 pay periods, you can still get Medicare. It's just going to cost you a little bit every month. Part B is with the doctors, preventative care, diagnostics. So when you saw that red, white, and blue card right here, everybody's got Medicare Part A and Part B. Some people just want to get that and that's it. But really, you're not taking advantage of what's out there now. And that would be the Medicare Advantage plan. That's what you're seeing tons and tons of TV commercials about. That would be the plans that offer dental, vision, and hearing in addition to your doctor visits, your hospitals. Also, we'll talk about more about that later. Part D. So Part D is for prescription drugs. So you want to make sure for you, if you're under 65 and you're signing up for Medicare and you want to just do plain old original Medicare, they call it A, B, and D. Let's forget about the C part. So it says D, you need to have a prescription drug plan from the very, very beginning. Why? Because if you don't get it from the beginning, then you're going to get a penalty of 1% of this certain number every month, and that'll be added. So I've had a person who's like 12 years didn't get it. So she had, but eventually this is what gives you a discount on your prescription. So by paying $15 to $70 a month for your Part D, then they'll give you a discount on your prescriptions. People that don't take any prescriptions said, why should I bother doing it now? And then they waited 10 to 12 years, and now this person's being penalized because she has to pay like $30 or $40 a month to get the Part D. Because you have, but they're still going to get it.
Yeah, Michael, let me just, this is where I want to ask a question, because
Sure.
you just talked about the penalty. If you don't take any prescriptions and you wait, and then you sign up for D, you're penalized, but the penalty is for life. As from my understanding, and I wanted to verify that.
Yep.
And they charge you how much per month for the penalty?
It's 1% of this. It's this number that they use. It's almost like 40 cents a month is what it turns out to be. So if I waited 10 months, it's $4. If I waited 10 years, it's like $40.
Oh, I see. Okay, and it's in perpetuity.
Yep.
But after you even sign up for it, you're still charged for it.
Yes. But the clock stops. So if it's $10, it's $10 from then on. Then you have to pay anything afterwards.
What does
But
that
you do have to pay $10 for the rest of your life per month. as a
Right.
penalty.
Okay. So they penalize you if you don't sign up for prescription drug plan from the beginning, regardless.
Correct.
So if you're sitting on your spouse's insurance, say, and then you sign up for Medicare and you do, Medicare A, which is free or whatever, and you sign up, for B, you figure out whatever, or you do an Advantage. If you don't do D, at that, you're penalized. Okay.
Well, let's go back a step. You said Medicare, if you sign up for Medicare Advantage plan, you're 65, you're automatically entered to prescription drugs. So you don't have to worry about it. It's going to just happen automatically.
Okay. Is that a wise thing to do? Is just get yourself signed up at 65?
Oh, you have to.
Okay.
Because if you don't sign up, then there's also other ways of getting penalties on your B and all. So you want to make sure you sign up. Just let's say you're working, someone who's working.
Even if I already have Blue Cross Blue Shield, I'm signing up, I'm letting them know 90 days before I'm turning 65.
But you said, do you have a Blue Cross Blue Shield?
Correct.
Employee
PPO
plan or Medicare Advantage plan?
PPO. No. I'm on regular Blue Cross Blue Shield right now.
Okay, but you're through the company or through under 65 with the ACA?
Through a company.
Through a company. So what you're going to do is when you turn 65, you have 3 months before and you have 3 months afterwards to sign up for Medicare.
Okay, that's what I thought. Okay.
So, but in this case, you want Part B, you're going to pay $170 per month once you sign up for Medicare A and B. But in your case, Barbara, if you're working, you don't want to have to pay that $170 per month because you're going to still take advantage of your company's plan. So you're just signing up for Medicare Part A only, not the D even. It's just
this
Part
is
A.
not, and again, let me clarify something. This is not my personal plan at ElderWorks. This is my husband's policy.
Yep.
Okay.
As long as you're on your husband's plan, you're going to just sign up. You still, when you're 65, no matter what, always sign up for your Medicare Part A.
Okay, perfect.
Thank you. Once you're not working, or if you lose your job, then you need to then do the Part B, and then you can do a Medicare Advantage plan. Also, let me see the next slide.
So then, excuse me, Michael, but if I I have a friend now that's just applying, her husband's applying. So if he's covered by his wife's insurance, she's working, then he does not have to sign up for D right away when he signs up for A?
Right now he's on his wife's plan,
Yes.
right? So you want to find out a couple things. If his company, some companies, once you hit Medicare age, they might sort of like, can you please, because they don't want to pay for you because it's always costs more for spouses, or sometimes they even charge a lot more for spouses. So even if you're on your spouse's plan and you're over 65, sometimes it's cheaper to switch over to Medicare Advantage anyways. But in this case, he has to make sure he signs up once he turns 65, 3 months before, for Medicare Part A. Doesn't need to worry about Part B, doesn't need to worry about Part D, because he's still being covered under an employee plan, so he's totally safe.
Okay, thank you.
But he still should have someone review his plan, because sometimes companies might charge the employee $10 a month and charge a spouse $120. I've seen that before.
Okay, got it.
All right, so then we got the D. Just one more, then we'll talk one more part, which you might have heard about. It's still pretty popular out there, but Medicare Advantage are taking over. It's called the supplement plan. You hear about people say, I have a plan F, I have a plan G, or plan N. Those plans do not cover prescription drug plans. So you have to sign up for that. So you're paying for a supplement plan plus a Part D.
Mhm.
If you're in a Medicare Advantage plan, that includes drug prescriptions. So this is why it's so confusing to people. They make it hard on people. And really, I mean, I work with it day in and day out, but that's where it gets really confusing.
Yeah.
All right, so you got your Medicare Part A and B. Everybody can get that. And then you want to make sure there's no reason why anybody should just do original Medicare anymore. Because why not get something that's $0 and then you have no deductibles and stuff like that. But people still think there's a scam going on with the government even. So we can talk more about that too. So qualified, eligible 40 pay periods we talked about. Qualify under spouse's benefits. Buy-in and not qualified otherwise. So like I said, if you didn't work 40 pay periods, then you pay. So if you just moved to America and you only been here 6 years or whatever, you have to pay for it. The hospital deductible, if you only have original Medicare, is $1,500. So remember, so you go to the hospital, you're paying that first $1,500 right away. Medicare Advantage plans, supplement plans, you don't do that. You don't have to pay anything. Then you see the more co-insurance, then day 91. So these are all fees. This is why you really don't want to just do Medicare Part A. And then they do cover skilled nursing, 100 days of coverage. You get the first 20 at $0, and it's 194 from days 21 through 100 if you need skilled nursing. So then there's Part B. We're witnessing this year, it went last year from 138 up to 170 a month. Everybody, that's why I said if your husband's working still, you don't want to sign up for B because you're going to start paying that money. You don't want to. But if you're going to go on full Medicare, you're going to be paying $170 per month for that. And they usually pull it out of your Social Security check. So keep in mind, for whatever reason, we've got our government working for us. Next year, I think it's going to be about $150. So it's actually going down 25. And they haven't come with the final number yet, but it's going down about $20 or $30. So from a big rise, they were always like $40. Now they're going back down 25. So that's good.
Yeah, the Alzheimer's drug payment issues, right? That's why they're going down. They didn't have to pay as much money out this year for that drug.
I don't know if it's that drug only, but Biden, he did this whole thing. They're working on prescription drugs being less money. A lot of things are in the factor.
Yeah.
Michael, somebody wrote for eligibility, it shows work 40 quarters, 10 years in parentheses, or what is the or?
Or qualify under spouse's benefit or by. It's just, it's a continuation.
Okay, I hope that helps, Maria. Okay, sorry.
No worries.
Mhm.
All right, so then we got Part A, Part B. We talked about the 170 and preventative services. So that's what Part B covers. I always say Part B is like doctors. So you got a deductible of $233 in Part B, okay? If we talk later about Medicare Advantage plans, there's $0 deductible. Also, it's a $0 deductible for supplement plans. 80/20. So if I go to the hospital, if I only had original Medicare A and B, I go to the hospital, it costs $10,000. Hospital pays $8,000, I pay $2,000. So that's what the 80/20 means. And then it's 15% more if it doesn't take the Medicare assigned rates. So that this is hopefully, like I said, I'm always a very honest person, and anybody would help. It's either Medicare Advantage or Medicare Supplement plans. I would never just do original Medicare. There's no reasons to do that.
You know what I don't understand is that 15% excess charge. I guess I didn't realize that existed. I thought if I had the supplemental plan, it paid everything. So Medicare pays 80, the supplemental pays 20, that's it.
Right. So you're looking, this is original Medicare. If you have a Medicare Supplement plan, 80% is paid by the Medicare, original Medicare, then 20% is that supplement plan you signed up for. That'll cover all the extra excess.
But then what is this Medicare assigned rates? If a provider doesn't accept Medicare assigned rates?
Let's say you go to Northwestern and Humana doesn't take, but none of the doctors take Medicare. So that's what it means. If you're doing a supplement plan that does not apply to any of this, this is only if you just do original Medicare only.
Oh, got it. Okay.
So then Joan learns that she doesn't cover all expenses, acupuncture, therapy, dental, vision, hearing, ambulance, prescriptions. All right, so she recalls prescription drug plans are covered under Part D. We talked about that briefly. So you can get just the Part D to cover your prescriptions. So if you want to stay original Medicare plus Part D, you're allowed to do that. And you just have to pay whatever Part D costs in the plan, or if you have a supplement plan. So you need to roll in your Part A and B. And remember, we talked about that penalty. If you don't sign up right away, that means when you sign up for A and B, remember, you're just signing up for A alone. I don't want you to sign up for your prescription drug plan. It's only once you sign up for the B part, and then you get activated for everything. If I'm talking too fast, Ray, just let me know. If you're getting everything, that's good. So I know you're writing down stuff.
What kind of penalty is there if you don't sign? I think I waited for a year or two and I have a $2 more every month. I thought you had said 40 cents.
Well, it depends on how long we go. Now it's about 40 cents a month. So if it's 5 months, you'd be paying $2 as a penalty today. I don't know how long ago it is, but yeah, it's your case. You said you waited 2 years. Then whatever that penalty is, and you're going to be stuck with that the whole time. The only time you don't have to worry about a penalty is, let's say, if you're on Medicaid and there's something called LIS, low income subsidy. Those people don't have to worry about penalties because they're on low income subsidy or Medicaid. And I don't want to go, there's so much to be talked about. I want to do more of the basics today, but we can definitely talk about that. So if you have family or friends who are on Medicaid, they definitely can get some great plans through Medicare as well. So you can do just a Medicare standalone plan, Medicare Advantage plan. We talked about all deductibles that usually apply. Drug list based on tiers, tier 1, 2, 3, 4. Like 1 would be like your cholesterol drugs, and then all the way up to your insulins. And then premiums are $15 to $100 for your Part D only. So that's how that Part D works. So you always have to pay deductible for Part D. The initial coverage period, get that year. Then there's a gap. You might hear people, this works for Medicare Advantage plans too. And when you do your supplement plans, you have a Part D, a donut hole. So donut holes are usually you get the deductible, whatever it is, $150. Then you're paying that discount for the prescriptions. And then that discount's not gonna be so great anymore. That's the donut hole. That's like, and then it goes to catastrophic coverage. And that will then be a lot less. So we'll go into that. So here's the initial coverage, donut hole, and gap. So it's between 43, once you spend $4,430 on your prescriptions, you're then going to be paying 70% of the manufacturer's discount. So it's going to be a lot. That's the discount. You're paying 25% up to when you have $7,000. Once you pass $7,000, then you're only paying 5%. So this is what Biden's trying to do, is trying to get those drugs down a lot cheaper.
Isn't he trying to decrease the time, or isn't that already in the plan? Decreasing the time of the donut hole from something to something.
It's not the plan period, it's the dollar amounts.
Okay.
Because some people can reach their donut hole in February and someone reach it in November. So
Why was I thinking he was going to do away with that donut hole?
there's so
Not
much
this
going
year,
on.
but in the
I don't want to
future.
guess.
Yeah.
Yeah, that's all those. Okay. So we're pretty good with Part D. So now we're really getting concerned, like what the heck's going on here? Premiums. What about how much am I going to owe for each of these plans? Deductibles, donut holes, co-pays, co-insurance. This is what we're all spinning our heads about. So then there's supplement plans. And that's, I don't know if Pam, is that what you have or not, but you seem to have mentioned it. So
Yeah,
this is where
I
you
do have that.
okay. So most people have an F that are older. They don't offer Fs anymore. That covers the most, but then there's also G and N plans. Sometimes called a MediSup or a Medigap plan. They're sold by private insurance companies. So it could be Mutual of Omaha. It could be United Healthcare, AARP, Aetna, all those plans. They work with your A and B. They cover the gap. So they always like to say it's something like this. So this is all your Medicare A and B. This is your supplement. So anytime there's a gap, they're going to cover it. So it's sort of like prepaying. So what you're doing is you're paying $120 based on your age up to $300-400 a month as you get older, because it keeps on going up in price. That'll always cover up that 20%. So if you do have to go to the hospital pays 80%, you pay 20% through your supplement plan. But since you're paying every month, you don't have to pay anything to the hospital. Okay, so if you're, once again, if you're gonna go see a doctor, you don't have to pay anything because you're paying that $170, $180, $130, depends which plan you're on, every single month. Then you don't have to keep on paying all these doctors and hospitals. Medicare Advantage, it's more like a pay-as-you-go. So I always do when I work with people, I take a piece of paper and I put a supplement on one side, Medicare Advantage on the other. We add up, multiply times 12. So if you, let's say, pay $200 a month with your supplement plan plus your prescription drug plan, that's $2,400 a year. Medicare Advantage, $0 deductible, and maybe you're only paying $1,800 and you still get the same coverage. Or it could be $3,500. So that's why I always look at both ways. I always tell people, if you're on certain things, like people have cancer, really are sick people to begin with, and they can afford a supplement plan, that's when they're really good, because certain drugs are not covered as well on on any of the plans. A supplement will cover it because those are covered under Medicare Part B. So if you're on a lot of cancer medications and stuff, a supplement plan in the long run is going to save you more money than Medicare Advantage plan. And when you sign up for a Medicare supplement plan like this, when you're 65, they don't look at your medical records. You have a period of time in the beginning, anybody can get accepted. But then after, I think, 6 months, then they're going to look at your medical records, and then they can say, yes, you can, or no, you can't join the plan. But I always tell people, sign up right away if you're thinking about it, but otherwise, you might not be accepted. But you're going to notice there's been a turn. More and more people are doing Medicare Advantage plans just because they get a lot more offerings. All right, so going to Medicare Supplement, works with A and B, I told you, helps cover gaps, like deductibles and coinsurance, does not include Part B. So if you're paying for a supplement plan, $170, you still need to get a prescription drug plan also. So you have to buy, you can have 3 different cards. You're gonna have a red, white, and blue card. You're gonna have a Medicare supplement card. You're gonna have a Medicare prescription drug plan, a PDP card. So it's a lot to carry around also. And you cannot have mix and match. You can't have a C, that Medicare Advantage, and a supplement at the same time. So are all supplements the same? They aren't. You can see the big differences here, but most times most popular now is G and N. And you can see why, for co-pays, for blood work, hospice care, Medicare Part A deductible. So why not get 100% covered? That's why instead of 50%. Remember that deductible was like $1,800. You'd still have to pay $900. You don't want to do that. So when we work with people, it's always a G and the N are always the ones we recommend. Plan N may have up to $20 copay for doctors. ER visits are $50. We all good so far?
Mhm.
Ray, you okay? And Carolyn and Hermina, I guess. Good. There we go. Good thumbs up. That's what I was looking for. All right. So there are other options. It's that C. It's the one you hear in all those TV commercials about, a Medicare Advantage plan. So I always tell people Medicare Advantage is an A, a B, a D, and then other benefits. So it's like a all put together is what a Medicare Advantage plan does. And why I like it, and everybody is really pushing for it right now, all the hospitals like it, is because the government, if you get a Medicare Advantage plan with Aetna, Humana, Devoted, whoever, they're going to manage everything. And because they are managing everything, the government doesn't have to worry about putting man hours and help on there. So the government gives out money every month for every person who signs up for Medicare Advantage plan, so they can go, okay, it's not my responsibility anymore, it's that carrier's responsibility. So, because I've had a lot of people say to me through the years, Michael, you're going to give me $3,000 in dental, you're going to give me over-the-counter benefits, $100 every 3 months, that's $400 a year, and you're going to give me $300 for glasses, and yet I pay $0 for this? There's got to be a racket to it. So this is where it's not a racket. People don't know the backside of it. They're getting subsidized.
Backside is that that the government is paying these insurance companies.
Yes.
Like almost like an HMO. We're giving you a certain amount of money a month to help pay for the expenses.
Exactly.
They're subsidizing the insurance companies.
Yep, because they don't have to manage it anymore, because there's no, if it's a supplement plan, they still have to manage that 80%. If it's Medicare A and B only, original Medicare, they have to manage it. And now United Healthcare, Aetna, Humana, whoever, they're the ones managing this. So since they're not doing that, they're saving money. They're letting Medicare Advantage plans do it. And also, which people don't understand, but I always say to you, I mean, Pam, you said you're a nurse. How many years have you been paying into Medicare?
Since I was 60. Well, no, I worked until I was 70. So,
40 years, whatever. So you've been paying into this already. So
yes.
That's also part of this whole calculation. So that's why they really love people to join in. That's why these companies now are starting to give away more and more stuff. I mean, it's surprising. Some give food away. All depends. We can talk more about it. And if you look at, like I said, I do that sheet, we compare left and right, but more and more people are switching their supplement plans to Medicare Advantage plans, because if they can save $3,000 or $4,000 in dental, why am I paying $140 per month on a supplement plan? And I don't even get dental or vision or hearing, and I still have to pay for prescriptions. So there's reasons why people stay on it too. I'm not going to say you shouldn't stay on it, but they're really trying to push everybody in Medicare Advantage plans. Even
Michael, we have someone that's getting a little lost with all the slides. And the one thing I just wanted to tell everybody is that, or just ask you, Michael, is this slide show available for ElderWorks to distribute to the people on this call or no?
I think I can do that.
Okay, so that's possible, or you can screenshot as we go along, everybody. There
Yep.
is a lot of material here, and if you have specific questions, again, this is just a community event for general information. You can call Michael directly.
Yeah, I mean,
Okay.
like I said, this is the reason why I volunteered, because my mom and dad, I saved them roughly $80 each per month because they stick with the same plan for 8 years. And it's like, why bother? It's like, it's so confusing. It's like, I like helping people. And this is the reason why. It's like, just to explain it, you might still be in the great plan, but every year, if it's not me, hopefully you work with some advisor, not someone on TV, and just to go over what you got to make sure, because they're always being more and more competitive every year. And
Can I take a little in the chat and you can say yes or no? Are the people that are on this call already on Medicare?
Yes.
So Ray is not.
Pardon me?
Ray is not. Pam is. And I don't know about Carolyn and
Okay,
Nina.
okay.
That I know it's two different discussions. When I've worked with people that are just aging in to 65, or if their spouse is not working any longer, that's a longer discussion. But then once I've worked with someone,
Okay.
it's more just an
But
update.
I'm referring right now to people that are on, that are confused on the presentation right now. Just to
Okay.
see, so Maria, do you have any specific questions you think you're missing? Because feel free to unmute yourself and ask the questions. Otherwise, the slide presentations, could be distributed, but I don't know how much that'll help you. Okay, so go ahead, Michael.
Okay, there is no dumb questions, and just so you know that, I mean, a dumb one I guess is not asked and answered, because it is very, very, very confusing, and it is your money. I mean, this is one of the most important things. Money, it's coming out of your pockets. You want to make sure, and then the other part is being covered. I mean, when I talk to people, I don't just put them in a plan just because I think it's a lot of great giveaways. I want to make sure their doctors are in every single, that one plan. Most doctors, your prescriptions are going to be the least amount. That's what we look for. A good agent would be looking at all that stuff. They don't just put you in something because they're getting a lot of great stuff.
Mike, do you have a slide on any disadvantages of of Part C?
No, but like I said before, what I could do, I mean, if you ever want later, I would do with you is I would just show you, look at your prescriptions you're taking. I look what you're paying per month. Keep in mind, every year, the supplemental plans are going up in price. Medicare Advantage plans are going down, more and more turning to be $0, because they're really steering more and more people into Medicare Advantage because government doesn't want to take care of this anymore. Medicare, I mean, it's either prepay, so you're doing a supplement plan, you're paying every month, so you don't have to worry when you go to the doctor or hospital, you don't have to pull out your wallet ever. That's great. The bad part is, if you want to go to the dentist or get new glasses, need a hearing aid over the counter, you might be getting $3,000-$4,000 worth of stuff that they're giving away.
So this is really privatizing federal insurance, health insurance, right? That's where we're headed.
Yeah.
Yeah.
I mean,
I hear such things. I subscribe to the American Hospital Association newsletters, and they talk about some of the drawbacks of the Part C, the Advantage plans. Is number one, they wait long to make their payments to the doctors. That's one of the things that's a discouragement. Number two is you have to have more approvals for things. They deny care that you wouldn't necessarily get denied if you're on a regular Medicare plan. So I don't know if those are true or not, but they're, I think
so if
I
you
worry a
take,
little bit about the private insurance companies and what they're ultimately going to do. So it's
I know you're
less now,
going.
but the price, I don't know. I just wonder, I don't know what they do for their prescription drugs. How do they do the 3-tiered system like the Plan Ds, or is it the same program?
Yeah. Well, it's 5 tiers, but yeah.
Okay.
But
Based
I know
on,
you're talking about, first of all, when it comes to like doctors, I always ask people, do you travel? Because that would definitely make sure you get a PPO versus an HMO, because you want to make sure you get a wider range of coverage. HMOs you wouldn't with the Medicare Advantage plan. When it comes to a supplement plan, what you're using original Medicare, any doctor who takes Medicare, no matter if they're a doctor usually the HMO Ppos, any doctor who takes Medicare has to then take the supplement plan with the original Medicare.
Yeah.
So that would cover that part there too.
Yeah,
But yeah,
I'm
it's
kind of a little leery about switching. I don't know. I just, it's hard to make that decision. I know it's cheaper, but I just don't know all the drawbacks of doing
There-
that yet.
I don't want to, I mean, we could talk offline. I don't want to steer you anyway. Only thing I would say though is there is a free look for 1 year. If you've not done it before, everybody who's got a supplement plan can change over to a Medicare Advantage plan. If you don't like it, you can go back to the supplement plan and there's no penalty. If you're like 70 years old and have had a Medicare Advantage plan, then want to try a supplement plan, they're not going to let you do that. They're going to charge you a higher rate and you still have to qualify because it might be some health conditions they'll not take you. Versus when
Oh,
you're
so you just can't
65.
switch back. Only
What?
1 year to switch back.
Yeah. So you could always say, you know what, this is not for me.
Oh, okay, I didn't know that. That's good to know.
Yeah. So I've had a lot of people do that too. And there's actually new Medicare Advantage plans that just came out. It's called a flex plan that acts just like a supplement plan. So, but you still get some little bit of vision and hearing, but it's a really high premium. You don't usually pay a high premium on an Advantage plan, but this plan is. Because it looks like a supplement plan, but we can talk about that offline because I don't want to confuse anybody more. All right, so are we good now, everybody, with the Part C? That's A and B, which is virtual Medicare. It's also D, which is your prescription drugs, and then other benefits like vision, hearing, dental, all this other stuff. That's all put together. That's where you're seeing tons of TV commercials. You're going to see Lionel Richie this year for Devoted Health. You're going to see Humana, and all these guys are going to be talking about it. All right, so when Joan reaches Medicare Advantage plan, she learns how to qualify. You have to be enrolled in your Medicare Part A and B. So you can't just have A by itself. You have to have A and B. So B, remember, that's when you get paid $170 a month if it's this year. You have to, I'm always going to ask someone, what's your zip code and what's your county? Because they're always based on your zip code and county. So if you might have a friend who has the same Humana plan for you in Florida, it's not going to work. It's going to be maybe a different price. It's just because of the doctors and pricing. And you can have end-stage renal disease, but that's a special kind of plan. It's called SNP. All right, so now there's HMO plans and then there's PPO plans. Both plans, you have to have Part B, $0 monthly premiums for your Medicare Advantage plans, co-pays, and then MOOP. MOOP means maximum out of pocket. So if you have a supplement plan, you don't have a maximum out of pocket because you're paying every month into this plan, 150, 200, whatever it is. When you have a Medicare Advantage plan, just like if you're under 65, if you've ever had insurance, you're going to say it's $3,000. So you're going to have no deductible, but after $3,000, you don't owe anything more. Everything's covered. $2,000, whatever.
Michael, can you,
Yeah.
when you get a chance, can you please look in the chat? Because there's a couple questions. It might be easier if you just look at those when you get a moment.
All right, I gotta. Chat. All righty, oops. I'm just trying to get to my chat in this.
So it says, how do you decide what company to go with for your supplement plan? Carolyn, you really need to make an appointment with Michael to discuss that. Michael can go over all the various plans. That is not something we're doing today. And then someone wrote A and B.
Wait, so I'm sorry, let me just finish that statement. So
Yeah.
Barbara's absolutely right. I can definitely help you. Keep in mind, supplement plan, if it's a G or an N, exactly the same, no matter if it's Humana, United Healthcare, Mutual Home Health, they're all exactly the same. You saw that one chart with all those check marks. Exactly the same. The only difference is the price they're going to charge for a premium every month. Otherwise, So I would just probably go to the least expensive one. In general, they're all generally good companies. So you definitely just would look at the pricing of it because they're all exactly the same. They don't offer different benefits like Medicare Advantage plan would. Okay, sorry, go ahead, Barbara. You still there, Barbara? You're on mute. You're still on mute. All right, so she's on mute. She'll come on when she's not on mute. All right, so then there's HMO and PPOs. So, but the easiest way, you got the slide here. For those that don't know HMO, PPOs, I think of an HMO as like a gatekeeper. So let's say I'm not feeling well. I'm gonna go see my general doctor and he's gonna prescribe whatever he needs to do. But let's say I hurt my knee. A lot of times you'd have to go to your general doctor, your HMO, and then he's gonna direct me to where I wanna go, which doctors are part of the network with him, and you're gonna be seeing those doctors. And let's say your next door neighbors have to be an orthopedic doctor. He's not in that HMO network. So he would be considered out of network. So you can't go see him. If you had a PPO plan, and doctors could be HMO, PPO based on the carrier. So if you have a doctor as your primary doctor and he doesn't know your next door neighbor, you can go still see your next door neighbor. You're just going to be paying a little bit higher copay because he's going to be considered out of pocket, out of network versus in network. Also, PPOs are good for people that are traveling. So if you go down to Florida a lot, Texas, Arizona, wherever you go to, then you can get medical attention from like your daughter's doctor. You want to go see him. That's totally okay too. With the PPO, it gives you more flexibility with doctors. Two things to keep in mind. If you go traveling somewhere in the United States and you really get sick and you have to go to the hospital, no matter if you have an HMO, PPO plan, you're always covered 100%. So they have to take you in a hospital if it's an emergency. It's just if you want to go to a local doctor, a local something, then a HMO from your local state won't work in a different area.
Which means, it kind of reminds me then that there are some cases, and I don't know the specifics, where people went to the emergency room, the Medicare Part C, the Advantage plan say that there wasn't a need for you to go to the emergency room. You could have gone to see a doctor, so they won't pay the bill. So they decide whether it's an emergency or not, based on what the doctor's writing in the note.
Right, and what you can do is
not to pay.
And there are some carriers that are a little stricter than that. I know what you're talking about, Pam. And what you can do, I try to make your job as easy as possible. There's only certain stuff I can even do to people, but as far as advice and all, but you can always do these appeals, and appeals are a pain and they can take a while. So there is a process to really say why you're there and get the doctors. And maybe 70% of the time, 80%, your appeals will win. Sometimes they won't, as Pam just said before. But like I said, if you're really sick or whatever, got to go to the emergency room. I'd rather you go than not go because you're not going to be covered. Is my big thing there.
Yeah. Okay.
So that's HMOs and PPO plans. Supplement plans you have to worry about, but you do for Medicare Advantage plans. Cost. Medicare Supplement plans, Medicare Advantage plans, both are have to pay that $170 a month. There's a premium, $130, $150, whatever it is, $200, $300, $400 based on your age, because it keeps on going up. They're very low. It could be $20 or $30. It could be $0. It's based on your needs. I always look for $0 first when I help people, but sometimes I'd rather you pay $20 and get a lot of other benefits that are going to save you money in the long run. Little or no out-of-pocket cost versus you do have this co-insurance. So that's when I told you about that line. I would go left and right for you. Any provider accepting Medicare, we talked about that, versus providers, networks and higher costs. Frequent travelers, important to use your own doctors. And then infrequent travel, fewer provider visits, want to save on premiums. So that's why Medicare Advantage. Drug coverage, there isn't any. You have to get that PDP plan versus it's included with your Medicare Advantage plan. Also, I really enjoy working with vets. So anybody who knows been in the military, they get something which I don't want to confuse even more. It's called just the Medicare Advantage plan. See the PD, prescription drug, this is called Medicare Advantage. Most vets use the VA to get their prescriptions, but they can still have a Medicare Advantage plan and take advantage of that money back, over-the-counter benefits, dental, and all this other stuff. So they can still sign up for a Medicare Advantage plan. It's not a prescription drug. So I can always help people with that as well. So just because you're a vet doesn't mean you still can't get this insurance. Original Medicare, choice 1, parts A and B, enrolled Medicare. You have to have Medicare Advantage plan C. And then you have Medicare Supplement coverage wanted. You can choose plan with included prescription drug coverage. Do you want that Part B or do you want to pay extra for it? Add Medicare Part D prescription drug plan, or it's already included. So that's what this slide's about. And then, like I said before, Medicaid is always there to help you. Helps pay costs not covered by Medicare. So I can always go into more detail with that if you know anybody like that. Medicare savings helps pay for Medicare Parts A and B. And then extra help, we talked about that. That's that low income subsidy I mentioned before, and that helps pay for prescriptions. So if you would be getting a penalty if you didn't sign up for your prescriptions, that can be done.
Yeah, I did not know that you could have Medicare and Medicaid at the same time.
Yep, that's
My
called a
sister
dual
now
plan.
has that. She lives in an assisted living facility,
Uh-huh.
and she has Medicaid as her primary, but she still has Medicare. I guess I thought you had to have one or the other. You couldn't have both.
No, my one friend, someone helped him before me, and he's got a prescription drug plan with his Medicaid. I'm like, now he's gonna be able to get $5,000 in dental. He's gonna be able to get a new pair of glasses, not have to worry about paying for it. He's getting over-the-counter benefits. Over-the-counter benefits every 3 months, they give you $50, $100, whatever it may be, and that helps pay either at CVS, Walmart, they have catalogs, and it could be Depends. It could be Tylenol, Aleve, ibuprofen, and all this stuff, and they send it to you, and you don't have to pay for it. So he's getting that. There are other benefits, and there's some that even give you food every month.
Is that with Medicaid? Is that
No,
a
Medicare
Medicaid
Advantage
plan?
plans.
Oh, Advantage plans, okay. So if she has Medicaid, is she likely enrolled in a Medicare Advantage plan then also? No.
It depends who's helped her, because like my friend, someone just signed him up for prescription drug plan. I moved him over to Medicare Advantage plan so he can get all this other stuff. Because I say, you know, if the government's going to give you the advantage, why not take advantage of that? And so he's going to get dental. He didn't have dental before. Now he's going to get a chance to get those over-the-counter benefits and food. He gets a meal card of $50 a month.
Okay.
And then they also offer, one thing also about Medicare Advantage, they offer transportation. So if you ever need to go to the doctor and back, all these places are offered 10 trips. So it's another thing about Medicare Advantage plans.
Interesting.
Also, they give something called silver sneakers. That's when you join a healthcare membership and you don't have to pay for your healthcare memberships. I mean, there's a lot of stuff. We don't have a lot of time, I know. And if you have a lot of questions, I totally am free to talk to you about this. So the enrollment period is starting next week, the 15th. So right now, if you really want to talk to me, I'd advise you to talk to me in the next 10 days. I can definitely help you afterwards, but I can definitely give you a lot more time now because it's our Super Bowl they called. So I literally worked last year from these dates, except for Thanksgiving and when Ohio State played Michigan in football. I worked from pretty much 7:30 to 9 at night because it's just so many people you want to get enrolled. So you have that window of opportunity. So I could definitely talk to you whenever, now or then. Just I definitely give you a lot more time now. And then there is ways you can get annual enrollment period outside it. If you moved to a different county, moving from different countries, if you had some medical conditions, long-term care facilities, if you're released from jail, there's lots of ways you can change it, not during the annual enrollment period.
I do want to make a comment to everyone while we're on here. And those show that slide again with the Medicare.gov. That'd be great. So people can copy that. So I did want to make a comment. There is no Medicare that pays for any form of senior living, and there's no Medicare that pays for any form of home care. Senior living is all private pay, home care is all private pay. So if people say I have Medicare, what retirement community can I move to? There is none. It's all private pay. In the state of Illinois, the only thing there is Medicaid. And there are some assisted living places or supportive living places that may take Medicaid after you pay in for a period of time, but they're rare. And then what they do is, and again, it's Medicaid, there's no Medicare. They pretty much take your income and leave you with a $90 a month spend down. When I say home care, I mean help with the shower, getting dressed, a caregiver in your house. That's what I'm talking about. That's all private pay. Okay, unless a doctor orders it after the hospital, that's under Medicare. But if you need a caregiver in your home, you need help with the shower, getting dressed, someone to help you with errands, someone to help you, that is all private pay. In some instances, people might have veterans benefits. People might be in need and can call Catholic Charities and see if they can do anything under their program. But I need everyone to know that Medicare does not pay for senior living or a caregiver in your house. So I just want to make a note about that.
And 2 points to that. Thanks, Barbara. There is, once I can't go into full detail. There are insurances that I can work with Medicare. We have these, it's like we call it a attachment, whatever you want to call it, but that can sort of mirror, they can help with those fees. So there is an insurance that does help cover people after they leave the hospital and does need those kind of care needs. So there is insurance you can get that's a lot less money than it would be if you had to pay it out front. So there is ways to get that covered if you needed it. Then I can help you with that as well.
And that's not long-term care insurance, or is it?
That's one of the ways to do it. We have other products, United Healthcare and other companies have stuff that I can add to their, so we're covering even the gaps with Medicare Advantage plans or supplements. We have a little thing that we can help as well that covers those gaps for under 65 or over 65. So that can be done.
Right. So again, you know, I wasn't going to start to get into long-term care insurance, but you know, long-term care insurance, if you purchase a policy like that, that could possibly cover assisted living, memory care, or skilled nursing.
Exactly.
But you know, those premiums used to be those, you could buy lifetime policies, all that, but they're sadly too much dementia in the population. A lot of those companies went out of business. So there are products out there. The younger you buy them, the better off you are. So for whatever it is, but that's a private conversation that you could never get referrals from Mike.
And then keep in mind, Barbara's right too, but let's say you have to go to a rehab place after the hospital, that would be covered that first 20 days. And then after days 21, it's going to cost you a little bit more money, but that part is covered for Medicare, but that's only rehab, not what Barbara was talking about. That's a little bit separate. So Medicare covers a little bit after the hospital, but has to go somewhere else. It's more of a rehab place.
Yeah, I always try to think of those things about what could be paid as more skilled. You have skilled professionals that are helping you as opposed to what I call custodial or activities of daily living, which generally are not paid for. Is that a good way to look at it?
Well, not really, because usually it's a trained CNA, certified nurse assistant. Most of these home care agencies that are licensed, insured, and bonded are sending CNAs that are trained as CNAs into your home. And I'll start my video, sorry. And so they're not sending skilled nurses in. Skilled nurse would come in if it's more like hospice, if it's home health. Home health means after the hospital or after a rehab and you go home, Medicare is paying for someone to check on you, do your vitals, do the basics. Some people say, you know what? My mom's got to have XYZ because non-medical home care, which are these CNAs, they can't administer medication. Right. So you get a lot of diabetics, you get a lot of people, they can't touch, they could point to it, but they can't touch it. Some people have to pay for nurses to come in their house.
I have a friend that has a problem with elephantiasis of her legs. And so when she gets an open wound, she can have a nurse come in and care for it. But once it's closed, no one can help her with prevention, like putting on her ACE wraps and doing the things to prevent it from coming back. So when it does come back, and it does, then they'll pay for the nurse to come back. It's just the whole prevention part of it isn't there. So it's like a little backwards in some, all of healthcare is backwards from that perspective, right?
Exactly.
There's no money in prevention.
I've included Michael's email again a few times throughout this chat. Michael, I think you had a typo on yours. But I know it's a lot of material, everyone. But just let me know as kind of I'm not gonna take a poll, it's such a small group. Like, did you all learn at least one or two things today
Oh, yes,
you didn't know?
definitely.
Okay.
I know it can be very, very confusing. And it's trying to, I mean, do I just pick up part? I did the whole big picture global, but each area could be, I mean, hours and hours, and you can't believe all the studying we have to do to get certified, but that's why you'd make sure you have a licensed agent. If it's not me, I want to make sure you have a licensed agent. And if anybody says you have to do this or give me a credit card number right away, that's what bothers me the most. That's why I joined this, because my honesty might be my worst asset. But I figure if I'm honest with you, Pam, and I say, I want you to stay with that supplement plan, hopefully you're gonna say, hey, Michael did me great. I want to tell them about my neighbors. That's fine with me. I just want people to know that I'm honest, and I don't have to sell to everybody. I don't want to.
And the other thing is that there's no solicitation. So anybody that comes onto an ElderWorks public event, there is no solicitation of anyone's emails or information to that.
Right.
You need to contact that person for specific questions.
Exactly.
So thank you so much, Michael.
Yes,
Just
thank you.
wonderful. And for all of you for coming on, Herminia, Maria, Carolyn, Parvis, Pam. Does anyone have any other questions, or are you guys good to go? Okay, well, keep coming to our events, get involved in stepping out to fitness, all the things we're doing. We're doing a food drive all month. If you have any extra food, you can drop it off the office for us. We're trying to do 10 months of 10 things of giving for our 10-year anniversary. So the month of October is a food drive. And we're really, really, really,
Where is your office?
we're at 251 East Northwest Highway in Palatine, and we're right in the strip mall where the Fannie Mae is and the Planet Fitness is and the hardware store.
Dairy Queen.
Dairy Queen, right by Nick's. We're right in the strip mall, right by the Sparrow's Nest that went out and went back in.
And also Citibank's there. You'll see the big Citibank sign.
Citibank's on the corner and all that good stuff.
Dairy Queen, peanut butter parfait.
Yeah.
Okay,
So,
thank you both.
are wonderful people. Much love in the new year, and love in the fall, and just Halloween, and enjoy. And Michael, thanks for your time.
Thanks. Bye.
Bye,
Bye-bye,
everyone.
guys.
Bye-bye. You're welcome, everyone.
Thank you, Barbara.
Bye-bye.